I want to talk a little bit about minimum standard of care, because this is something in the article that I'd never seen laid down. You talk about there are scenarios where the veterinarian offers passive therapy that are not good enough. And it sounds like even if you document those things, there are some things we should just flat out refuse to do because it doesn't meet the minimum standard. Can you talk to me about the minimum standard and what it means to meet that? And then what happens if I don't meet it?
Yeah. So the minimum standard of care is a difficult concept to understand. Minimum standard of care is actually defined in some practice acts, and it can be what a competent average veterinarian could reasonably deliver in a same or similar circumstance. So it's just basically saying, are you reasonable? Are you average? Would somebody else do the exact same thing or a similar thing if they saw a similar case? One veterinary lawyer that I talked to said, standard of care is, if it ended up on social media, would you be embarrassed?
Yeah, that's standard of care.
If the answer is yes, that is below the standard of care. To use an extreme example, a dog comes in with what you suspect is a ruptured gallbladder mucocele. What is the only way to treat a ruptured gallbladder mucocele?
We're going to surgery.
Right. That is the only way to reasonably expect a good outcome from that. Below standard of care would be saying, have some Pepcid. That's just an example. The standard of care is determined by the board on a case-by-case basis in response to a complaint. So a complaint has to occur first for the board to take a look at whether or not the standard of care is met.
It's interesting because the client plays such a big part in this, right?
Yeah.
And it's always interesting when we start to kind of butt heads with the clients about what is acceptable or what is not.